This is Karen with NewClevelandRadio.net, and it is time for Lessons Learned. And on Lessons Learned today, we are going to be talking to two women. D is one, L is the other. As you noticed, we're not giving out names today, and there's a good reason for that. We're talking about a very, sensitive subject. It's called pelvic prolapse. And you may not have heard about it before, but you may be experiencing some of the symptoms. And so, as we talk about it, you can understand why our guests have chosen that they don't want the whole world to know what they're going through, but they do want the whole world to know that this is normal and there are opportunities and choices out there to get better. So, I'm going to begin a little bit with my story. About 12 years ago, um, all of a sudden, I was telling my husband that sexual intercourse was painful and painful to the point that, um, in addition to my migraines, I had a good reason to say, no, honey, not tonight. And that was a little unusual for him and for me. We didn't quite understand it. And I actually went into a deep depression over it, feeling like I was letting him down more than I was letting myself down. I went to a number of doctors, and they all said to me, "Oh, this is normal. Oh, just Karen, bear with it. If you love your husband, just have sex." And it was like, "Are you serious? I'm crying. I'm in pain. I can't walk afterwards." But nobody was giving me an answer. So about 3 years ago, I found a doctor who sort of gave me an answer. And he went in and did these saline injections because this was supposed to make the pelvis get back into shape. I have since found out that that is such an old technique and it doesn't work. And yet I spent a couple $1,000s having that treatment.
Wow.
Recently, I went to a new doctor, and I have to say, I'm working with a female doctor who totally gets me. And that's the key. Whether it's a male or female doctor, doesn't make any difference. If you have a female issue, you got to get out there and talk because a lot of times women are looked at as complainers and doctors sort of overlook what we're talking about. So now I'm in treatment. And when I decided to start my treatment, I realized that there's about 40% of all women who have had children, even just one child, that have a form of pelvic prolapse. And I realized after going through my mother's medical records, the last 10 years of her life, she suffered from it. She was afraid to go out in public because she couldn't control herself. And so the last 10 years of her life were very, very difficult for her. I don't want to be in that situation. So, and I don't want anybody else out there to be in that situation. So, I'm going to start with you, Dee. Um, I know you're going through something similar, not exactly the same. And so, tell us a little bit about your history.
So I feel like it came on very suddenly for me. However, I really realized it did not. It wasn't so sudden after all. It only felt like an emergency at that probably about a month or so ago, probably 2 months, because I had never experienced anything like this. Now, I have been urinating a lot, but I just thought that was me. And I didn't realize it was, part of my problem is my bladder is prolapsing as well as the rectum. And I had no idea. So I must tell you that I probably freaked out and called my friend Elle, who's a nurse and had experience with this. And thank God for her because I had no clue, that what was happening, and it was very scary. And gosh, do you want some symptoms or what did I do next?
So when you called Elle, okay, she obviously reassured you.
Yes, she absolutely did, and told me a couple things I could do. But I don't think she even realized the extent of what I was going through, because but I couldn't give myself an enema. It was like, what is wrong with me? Um, and I just so happened to have an appointment that week with the gastroenterologist who had recently done no, he hadn't done the colonoscopy yet, but I was there. I'm sorry, I eventually had the colonoscopy, but they just kind of poo-pooed it, no pun intended, as a mild prolapse. It wasn't happening at the time of the colonoscopy. And I was like, well, what do I do? Well, you can go see a urologist or you can see a colon surgeon. And that was the extent of that. And my female gynecologist saw me as an emergency, and she basically said, "Oh, it's not cancer, so don't worry. It's just a mild prolapse." And I'm like, I don't know what that is, and she didn't have time to tell me. So she's no longer my gynecologist, obviously. But I just really now I am. Well, I'll let you go ahead and ask some more questions.
Sure.
Right now, it's just cramping, diarrhea, or not diarrhea, constipation.
So you have the constipation, you have bladder issues, and cramping, and that's no way to live a daily life. Absolutely. So, Elle, when Dee called you, um, you had the experience in this. So, what were your words of wisdom at the time?
Well, it's interesting that Dee said that I didn't quite understand the extent of it, and I think that she really taps on something that's so true for us, for a lot of for men and women, but especially for women, not having the proper words to describe what's going on, and also anything that involves our down there area and our private area. We don't want to talk about because it's too gross and we feel disgusting by talking about it. And anything that involves, passing waste regarding bowel movements or urination isn't really disgusting.
Right.
So never mind sex. Sex is hard enough to talk about, but then you add elimination on top of that, and it just is really horrifying for women. And I would say that Dee and I are very close friends, and it was still really difficult. I wasn't really getting a clear picture, I think, because she wasn't really explaining exactly what was happening and didn't have the right words. Now she has the right words, but didn't have them at the time. And for myself, I would say that was a similar experience, because I actually had a bladder prolapse. I was very young. I was only, I think I was 31 or 29. Yeah, no, I was 29 actually when that happened. And I had vaginal deliveries for two children. One that one child in particular that did some damage internally, regarding my vaginal area, and that's really what caused that prolapse. But at the time when it happened, I thought it was my uterus prolapsing, and I panicked and called my gynecologist. And of course, she reassured me, "It's okay, don't worry. We'll have you come in." And she just said to me, very matter of factly, "Well, I'm really sorry that you're such a young woman and you're going to have to deal with this for the rest of your life, but you have a prolapse, and that's the way it is." So I just sort of accepted it. Again, I don't know if it's because of my age at that time or just my experience or maybe my nature, but I just was like, okay, this is just what I have, and that's that. And I just went on for the next 20 years. Now I'm 53, so it's a much different picture, dealing with it. And I think when Dee and I spoke, I think she was surprised that this has been going on for me for a really long time, and she wasn't aware of that.
It is a very long time. Um, I had a bladder repair when I had my hysterectomy, and I was told, "Oh, we got it up there so tight, it's never going to fall."
Mm-hmm.
And now I've looked at my records, and my records indicated back then that I had pelvic prolapse, but nobody told me about it. So I wasn't even aware. If I had known back then, maybe some of the physical therapy, some of the exercises may have helped.
Right.
But not knowing, you go through life doing what you think you need to do.
Right.
And, it's difficult. So, Dee, when you called Elle and you felt like she didn't understand completely, did you realize it was because you didn't have enough information to really give her?
Now I realize that,
Now
now I do, because I really had no idea what was happening to my body. And, I've never had children. So they tell me it's because, I've had menopause and my tissues are thinning. So not only do I have a rectocele and a cystocele, it's a prolapse of the rectum as well. And I mean, I never even had a hemorrhoid. So I was like, what is happening to me? I had no idea. And so I'm just thankful for a friend. And, I didn't want to tell anyone else at all. But now I'm slowly able to say, well, I need to have pelvic organ prolapse surgery, and leave it at that.
Well, and I know that what led me to go back to the doctor recently was that I was having bladder issues, but my rectum issues were the complete opposite of yours. I can't evacuate completely.
Mm-hmm.
And so I walk around not knowing when I have to run back into the bathroom to complete. And it's like, it's great that I work from home, but I do work out of the house on the weekend. And on the weekend, I'm terrified because I work with a lot of young people, and young people really don't get this, or they look at you and go, well, you're older, so of course you're going to have this. But we don't have to. And that's one of the things that my new doctor sat down and talked to me about. In fact, for the first time, I was allowed to, shouldn't say allowed to, but I let myself cry. And I didn't have a doctor or a nurse looking at me like, hey, stop the tears. It was like, yeah, get it out, cry. It's all right. And my husband had come with me, and, he shared his frustrations, things that the two of us really haven't talked about. And it's really important to hear your body and to be able to understand what's going on. So, Elle, as a nurse, did you understand more of what you were going through than maybe Dee or myself?
I feel like I did understand, but I didn't really recognize that there was a treatment for it. I felt like all the doctors I've talked to, when I went to the gynecologist, my first struggle was really with urinary incontinence, and I went and I had a sling procedure done, which probably lots of ladies have had, which is just an outpatient procedure, but it is a surgery, but it was effective. It did definitely help. But like everything, your weight is definitely a factor when it comes to urinary incontinence. And I am overweight, but I was even more overweight then, so that made it more difficult. And also the other factor is also your activity level, and caffeine, all things that are so important to me as a woman, having a nice cup of coffee in the morning, and being active. So those are all bummers that you can't do that when you struggle with urinary incontinence. And also the after I had the sling, I sort of thought that was it. This is all I can do to make this improved. The other problems that I was having with my bowel movements, when I talked to the gynecologist about it, again, it was with great shame. I just felt really embarrassed to talk about it. It was pretty humiliating. I felt like when I explained what was going on, they were like, oh, okay, yeah, I understand what's happening. I think you have a rectocele. And then he gave me an exam and said, oh, yep, you have a rectocele, but it's not that bad. So just keep kind of doing what you're doing. And I was just sort of been researching, and I've just been the techniques that I've heard on, that I read about on support group networks and that sort of thing about bowel regimens and that kind of thing. But I actually just recently went to a doctor as well. And I had a very similar experience you did. I felt like for the first time in 10 years, it feels like the best medical appointment I've ever had. We actually spoke in the doctor's office prior with my clothes on. Then we went in and had an exam with another person there. So I wasn't even just alone with him, and then went back to the office to talk about a plan. I mean, I haven't had that happen in seriously over 10 years with the way healthcare has changed. And women's health has just, degraded to the point where, we have to get naked before the first time we're meeting our doctors.
Right.
So, this was really a big moment for me, and just, explaining to him what was going on. And he said, oh, okay, yeah, we need to fix that. I was like, wow, we can fix it. Excellent. I'm so excited because really it was getting to the point now, again, I'm sure it's because that I'm older, that it's interfering with my work. I'm a visiting nurse, so I travel a lot of the day. So now I cannot drink at all day that I'm in the car. I have, big fear about it. And that's actually what prompted me to call the doctors, because I was really not going to make it to the next patient's house. And now with COVID, I used to know every bathroom, from here to there.
Sure.
But now with COVID, those bathrooms are not available. And I was really, really suffering. And I thought, I'm not going to be able to work. I'm not going to be able to do my job. And, really talking to him gave me hope that I can get some relief. And he gave me some medicine to start out and some estrogen cream, which really helped also. So I just feel like that meeting that one doctor, I'm so sorry that I've had his name for a few years, but I just never called him. And I am so grateful that I finally did.
Well, I think sometimes we don't make those phone calls because we've had those bad experiences. We're tired of hearing over and over again, you're a woman,
Right.
this happens.
Suck it up.
Yeah, exactly. I have a great internist, except basically he's always telling me to suck it up. And I'll look at him and go, now, if I were your wife, what would you say? And he said, oh, I'd say the same thing. It's like, oh, that's great. I sort of feel sorry for her. But I then since have realized this is not his expertise. He doesn't know.
That's
And
right.
when I was asking for referrals, he didn't even know who to send me to. Now, living in Cleveland with the Cleveland Clinic and University Hospital, you would think, that a name would pop out.
Right.
And it took him a couple of years before he finally said, you know what? There's this woman at University Hospital, and this is her specialty.
All right.
Why don't you go see her? And it took me 3 months to get in, but you know what? It was worth the wait for 3 months.
Yeah.
So some of the things we're talking about, like you said, they are embarrassing. In the beginning, I wasn't even telling my husband the problems that I was having.
Mm-hmm.
He sort of guessed what was going on, but all of a sudden he said, when you come to bed at night, you're more covered up than normal. Well, I was wearing a pad every night. I didn't know if I was going to have a problem. And you know what? We've been married 37 years and I shouldn't be embarrassed, but I'm a woman and I want to feel attractive to him. Mm-hmm. And to me, that's not attractive if you have an accident.
That's right.
So
that I have to just say, like, from a nursing perspective, like, that's a universal truth for all people. Our dignity is the most important thing for us. And when we lose the ability to control elimination, that's just a basic dignity. And no one wants to lose that. And then for women, I think, again, tied into that, younger women, is our sexuality and our sense of, who we are and how we feel in relation to our body and our partners. And that's such a critical element that you mentioned.
Absolutely. So, Dee, we know that you are looking towards treatment.
Right.
And you finally found somebody who's working with you.
Right.
Go ahead.
I did want to just say the first doctor I went to who, is a very distinguished, he's a professor in a teaching hospital. And I went to his office and I was not impressed at all with him. And I didn't have a chance to sit down and talk with him either. He was kind of rushed in and, get undressed in a quick exam and, well, you have this, and he took measurements of whatever, but it was kind of odd. And then he said, well, you can have a surgery and get a colorectal surgeon, and then I'll just come and jump in on the surgery, and kind of left it like that, and no explanation really. So I said, okay, this was me referring myself to a specialist, but my primary care physician, whom I love, she referred me to a colorectal surgeon. And I met this man, and immediately I felt at ease. I mean, just the way he spoke with me. I had my wife with me in the room. He talked to us like human beings, and he said, don't worry, I see this all the time. You don't have to be embarrassed. It's
Don't be embarrassed, right?
And it made such a huge difference.
Absolutely.
That I immediately knew this was the guy I wanted to see for a doctor. And I'll tell you, if you're a woman and you have a gut feeling about a doctor, you have to listen to that and to see someone else, and I'm fortunate right now because I'm not working. I need to work, but because of COVID, I'm unemployed right now. And I also have the best health insurance I've had in a long time, which is through the Affordable Care Act. And if I didn't have that, I don't know what I'd do. Which makes me wonder, what do women that don't have anything do? It's just horrible.
When my mother was going through all this, and none of us knew what it was. In fact, her doctor, she had a female doctor who kept telling her to take Metamucil more often. She said that would bulk her up, and it didn't, so it made her condition worse. And I started asking questions, and even her doctor would turn to me and say, it's normal, don't worry about it. And, your mom's in her 80s and 90s. And so where is she really going? Well, my mother was an active woman. And it was like, don't look at her age. Okay. She wants to live her life. And this is not living her life, staying in her apartment most of the day. And she used to come to visit us in Cleveland, and she was afraid to take that 3-4 hour drive because, what if she didn't get to the rest stop fast enough?
That's right. That's right.
And so the more I learned about that, I started real understanding too, that this is also a hereditary issue. And so you said you haven't had children. Well, it's hereditary. So somewhere in the family genes, okay, you develop this. And that's why it's so important that we talk about it. And, you don't have to talk about it to all your girlfriends, but you got to find somebody who's going to listen, and you have to find that right doctor. And I'm glad that you did, because I have a friend down in Florida right now who's working with a doctor who just basically wants to cut everything out of her. And it's like, I think you need to get a second opinion. So what do you see as your future coming ahead here?
Me?
Yes.
Well, I really don't want to wait as long as I have to wait, but I will. I feel like I have to get all my heavy duty gardening done because I live in the South, and I'm not going to be able to lift. So I'm just really working in my yard and really want to have the surgery and be okay and get back to my whatever kind of life I've been having these past it'll be better. I know it'll be better. It's got to be better. And I, like I said, I've never heard of this before. So
most of us haven't. And I'm sure when you shared it, with your wife, her eyes probably popped out too, because
Yes. She said, call Lauren. But, I just want to say, my parents, my mom, my parents didn't talk about
of course not.
feelings, and my mom certainly never would have talked about something like this. And they're both deceased, so I really have no idea, about if they had any of this or not. So.
Absolutely. And Elle, how do you see yourself going forward now?
I actually feel really positive because also when I had this exam with this doctor, he diagnosed me with it was so devastating when he said the words, but it really rang true, was severe vaginal atrophy. And which to me, I called my friend and just said, I have a sad vajayjay. It's very sad. I have the words for it now. But, I had known that I had a sad vajayjay. I knew I did, because I wasn't, I really wasn't enjoying sex. My libido went down, and I am in menopause also. So I sort of chalked it up a little bit to that. But, it's been going on for a couple of years. And, just in terms of sexual activity, I mean, I have researched every kind of lubricant in the world, because I also just have a lot of allergies. So I couldn't use a lot of the lubes that are out there. The silicone-based lubes I'm allergic to, I couldn't use those. So all this stuff. So sex really has just become not interesting at all for me anymore, which was really sad because, I like having sex with myself. I like having sex with my partner. I like to be sexual. I like that kind of energy. I think that's great energy about women. And I felt sad to lose that. So he prescribed actually an estrogen cream, which has really been helping a lot. And and he said to me something really interesting. He said that he felt like this is one of the biggest travesties to women's health, is that estrogen has such a bad rap because of the concern about ovarian cancer, which is not an issue with cream, although there's still some concern, and you can certainly find literature and blogs that don't support the use of it. But I don't have any ovarian history in my family, ovarian cancer history. So I don't feel that I'm at risk at all by using it. And it's made my vagina a happier place to be. And I'm happy about that. Well, so that's really great. So I'm celebrating. And then also in terms of I'm planning on having surgery, but I do have to postpone mine because of work-related reasons and life-related reasons. So I can't have mine till June, but I'm looking forward to that too, because I am hoping that that my bowels will be functioning better, that my, incontinency will be a little bit better. And I'm in just a different place of acceptance around it, like even buying an incontinence pad, like I've just been using sanitary napkins because somehow that felt better to me. And, that was one of the first things he said to me. He was like, you know what? He's like, you're going to be happier if you just buy these pads. So I researched them. I found a better pad. I've been using those, and that's even been helping. Just, using a product that will actually help in case there is incontinency, so I don't have to wet my pants or be embarrassed or any of that stuff. And I just take care of it. So I am feeling pretty positive that the surgery will improve that. And then I feel like having a provider that will work with me is also feeling better. I mean, and to be honest with you, this is the most candid conversation I've ever had about this with anyone, including my partner, who I still really haven't spoken anywhere near as candidly. I probably never will, because I definitely don't even want to talk about it with her. But it's so that's really how difficult this topic is because it is just so very, very I think just connected to our dignity, and I just I don't want to be talking about that with my partner.
And I totally get that, because it took me a long time. I was hiding in the bathroom, and finally, he said to me one day, "Is there a problem?" And I said, "I think you figured it out." And he just looked at me and he said, "You can tell me anything." And I broke down because, yes, I could tell him. And when I told him, I said, "This is embarrassing." And he goes, "And what if it were me?"
Right.
And I looked at him and I said, "Oh, well, I would help take care of you." And he said, "So why aren't you letting me help you?"
Yeah.
But again, I still feel vital. I don't want somebody taking care of me.
Absolutely.
But
Yeah.
but that's an issue that a lot of us women have. We are afraid to talk about certain things. Men talk about their prostates all the time, and
Mm-hmm.
they compare them, and that's not something that we do. But
I mean, and honestly, really, ladies, like when you think about it, men's impotency, right? We see TV commercials with the guys in the bathtub, the Cialis commercials. There's, and that's how normal it is and okay for them to talk about and fine. And meanwhile, this is just like, well, this is just your sexual death sentence. You've hit menopause. Too bad. Your vagina is drying up, and just deal with it. And that's what a terrible thing to say to women, and terrible to the point where I've internalized it and was just like, okay, yep, this is it. Okay, I'm ready for my death, for my vaginal death. This is it. Goodbye, vagina.
Well,
So
luckily
true.
we don't have to say goodbye. We can find the right physicians out there. I know the year of COVID is making it even harder for a lot of us, but you know what? We all will get better. And talking about it, I think, makes us feel a little bit better because we know that we're not alone. And
Mm-hmm.
Dee, when you responded back to me, I was so excited. And since then, my email is just like inundated with women who are going through this.
Really.
They can't find doctors that want to treat them. Um, and all I can say is, the three of us, we pursued it. We pursued it until we could find somebody that could help
And
us.
we have to continue. And I don't know if you've seen a Euro gynecologist, but that's one doctor whom I've never heard of, a Euro gyno. So, and of course, my colorectal surgeon,
Right.
who I really like so much. So I'm so lucky to have this man as a doctor.
Well,
I have to drive. I have to drive almost 2 hours to see him.
Yeah, it's incredible.
So that is not at all fun for me. I mean, I'd rather take a drive and see something beautiful, but I do manage to, stop along the way, coming back at a garden shop or something that makes me happy.
absolutely. Absolutely. So, what kind of recovery period are they talking about for you?
For me, it's he said it could be from 3 to 6 months recovery, total recovery. So he said the first I think he said 6 weeks would be the hardest. But I'm also having robotic surgery as compared to regular surgery. And this robotic is going to be less invasive. And my healing time should be much shorter. But he said, even though, because I'm going to have because of my three different issues, I'm going to have to really take it easy and not lift anything.
Right.
And I'm not good at sitting around and not lifting something. So that's probably going to be the hardest for me.
I'm sure it will be. And Elle, what about you? What kind of recovery period?
It's basically what he said is that if you have like a sitting down job, you have to be out of work for about 2 to 3 weeks, 3 weeks really. And then if you have the kind of job that I have normally, it's like a 6 to 8 week recovery. So it's a lot of lost time from work for me. And I don't know how quite I'm going to manage that yet. I can work from home sometimes. So I'm hoping that it just works out, that I can do it, because I only have about 4 weeks. I think by the time I'll have the surgery, I'll have about 4 weeks of vacation, sick time. So I'm just hoping that covers me. And I'll just sort it out with my job,
Well, I know we all run into those situations. Um, I'm starting out with what they call Botox injections, which is supposed to strengthen the pelvic wall. and we're going to see how well that works. If not, I too will be having surgery. And they also told me it could be 6 to 8 weeks, where I really shouldn't drive and I shouldn't be standing on my feet all day long, although exercise to some degree will be good. So I understand I may sit at this console hours during the day, but when I'm done, I like to be up and about. And so it's going to be difficult, but you know what? It'll be worth it.
And I just also want to just tag on to what Didi had said before, was that regarding healthcare, one of the things that was suggested to me along the way was pelvic physical therapy. Yes. And that is a real specialty, but I did actually find a pelvic physical therapist, but that's not covered by insurance. And at the time it was, this was many years ago. It was at least 10 years ago. And it was about $75 an hour then. So I'm sure it's more now. And that was completely out of my price range. I did not have the money to do that. And like I said, it was not covered by insurance. So that was just out of the question, but there's really good results with, from what I'm read about this, pelvic physical therapy. And like, that should be, again, I feel like if this was a male problem, it would be covered, and, you probably get paid to go to it,
Yeah, probably.
So,
well, I will tell
I think that's important.
Yeah. Under Medicare, it is paid for.
Oh, that's good.
For so many sessions, but that means that you have to be in that bracket. So I went through physical therapy.
Oh, you did?
One bout. I will tell you that in the beginning, I sat there and I talked to the physical therapist because it was too invasive for me.
Right.
But I really did like her. I really did trust her. So I started going through the therapy. I didn't have good results, and she's one of the best. But because I'm going for these injections, Medicare says you have to have physical therapy. So I'm going to put myself through that. It's just like having an exam. So, you grin and bear it, because if the end results mean that I can get some of my life back, that would be absolutely wonderful.
Yeah. Yeah.
Well, I want to wish the two of you the best of luck. I want to thank you for sharing with our listeners that this is a real issue. And hopefully after your surgery, Dee, we can have you back and you can be telling us how terrific you feel. Okay.
Sure.
And Elle, I hope that you can take the time that you need to have your surgery get better, and all of us maybe can go dancing in the fall. That would be great.
Oh, that sounds like a great option. I like that. Yeah. Okay. With no pads, pad free.
Pad free.
Pad free. That's going to be my new motto.
I love it. Well, thank you again, and have a great day.
Thanks so much.
Stay well.
Thanks for having us. Okay. Bye-bye.
Bye.